Now, the World Health Organization wants to rename the monkeypox virus. The organization hopes this will help remove stigma and inaccuracies around the disease. A report compiled by scientists raised concerns that a lot of media and some scientists are trying to link the current global outbreak to West Africa and other parts of the continent. For more on this, we are joined by Dr. Fiona Barker, who is the Program Manager for Emergency Response at the World Health Organization's Regional Office for Africa. Thank you so much for your time. We do appreciate it. Perhaps just speak to us about why the decision was taken, given the reasons I just mentioned in my introduction, for the World Health Organization to consider renaming the monkeypox virus.
Thank you, Heidi, for having me this morning. Just to say, monkeypox is not a new disease. It was first detected in the human population way back in 1970 in DRC. And since then, 10 countries in Africa have reported cases. Typically, these have been countries in West and Central Africa. However, over the past month, as you all know, it has attracted a lot of attention globally. We have seen cases reported from countries that have not previously reported monkeypox. We now have a total of 39 countries around the world that reported cases. What is atypical is that we are seeing many cases in a short period of time with human-to-human transmission in countries that have not been affected before. And in most cases, there's no history of travel to Africa, which may imply there was undetected transmission for some time, although detailed investigations are still ongoing. So this is of concern to WHO. We are in discussion with experts and technical advisory groups around the world on changing the name of monkeypox, its subtypes, and the disease that it causes. The name monkeypox was given before current best practices in naming diseases were published. So names should be given with the aim to minimize unnecessary negative impact on trade, on travel, on tourism, or animal welfare, and to avoid causing offense to any cultural, social, national, or regional, professional, or ethnic groups. So we are in that process of discussion. It is the responsibility of the International Committee on the Taxonomy of Viruses to do the naming. And this process had already been underway to reconsider naming all the a group of viruses that monkeypox belongs to, the orthopox virus species. So it will continue.
And you mentioned an important point here where you say that there's a lot of discrimination that's going on here, and this is possibly why the scientists decided to come out and say there's a lot of inaccuracies. Dr. Fiona, this also could possibly cause a risk of people not coming forward and saying, these are my symptoms, I could possibly have the monkeypox virus because of the stigma that's attached to this particular name. So naming a virus is really important, and one wonders why anybody would even consider naming a virus monkeypox or having this particular name.
Yes, it is important that people feel safe to be able to come and once they have symptoms, report to a clinic for further investigation. That is the only way we can be able to quickly isolate whoever is confirmed as monkeypox, because as you know, it spreads by physical contact. So it's important that these are identified early and that the necessary treatment is provided. So which is why we have to remove any possibilities of stigma around the disease, because from a public health control measure, it can only work if we can get these people identified quickly.
Do we know what the possible new name could be? And do you not think that the damage is already done? I mean, if I look at what happened with COVID-19, the various variants were named after the Greek alphabet. But when Omicron decided to hit, it seems as though there was so much stigma attached to that particular virus. Do we know what the new name could possibly be, or what the thoughts are around this to avoid any further damage with regards to this particular virus and people not wanting to come forward because of the stigmas attached?
Yes, you're right. This is not the first time a disease will be renamed. We've saw that with COVID-19 and the various variants that were previously linked to countries. So that does help to rename. It's too early to say what the new name will be. The naming is the responsibility of a special committee on taxonomy of viruses. So they will be deliberating on this, taking into consideration all the possible nuances to avoid stigma to any group.
Just lastly, do you not think that the damage is already done with regards to this name of this particular virus?
Well, I personally don't think that it is damaging. What we intend to do is prevent it from getting any worse. Because it's attracting a lot of attention. As I said earlier, this disease has been in Africa for decades, and we've not had this challenge around stigma. So I believe now that it's getting more global attention, now is the time to take that step.